And we are here once again on KBBF Bilingual Radio. And this is your show, Líderes del Futuro. We are on KBBF 89.1 FM and on kbbf.org for people who are listening outside of our service area. And just like we've been doing for a while now, we have Mr. Marcos Mejia. Señor Mejia, welcome to the show once again from the County of Sonoma. You are the individual who has been bringing us a lot of information. And for a while we said, let's slow down. Instead of doing it every week, let's do it every 2 weeks. But it seems to me like things are changing, a higher number of cases perhaps of COVID.
That's correct, Rafael. We may come back to once a week instead of once every other week. We're seeing that the uptake on numbers that we talked in the previous weeks continues to increase. I'm going to give you details about it in a minute. But that is the tendency. We're seeing more and more people also who is fully vaccinated and fully boosted, now that there are even 2 different boosters. Or the term that is being used for all of this is to keep your vaccinations up to date. Mm-hmm. Are your vaccines up to date? That's the question. Why is that important? It's a simple question. What we're seeing is that according to data, if you have your vaccinations up to date, you have the better chances to have a very mild case of COVID if you get infected. Exception mates are those who have any history of any chronic condition that affects their health and consequently affects their immunological system. Mm-hmm. My English is failing me. But their systems they are immunocompromised. That's mm-hmm. what I'm trying to say. So they tend to have a harder outcome. Like I was telling you before we began the show, that one of my coworkers, his wife got infected, and she's boosted. She's boosted too, but she's having a harder time. She's in bed now for the last 3 days, having really bad symptoms. He is negative. Mm-hmm. He came with a negative result and has like 0 symptoms, but it's in isolation, of course, in quarantine. She's in isolation, mm-hmm. He's in quarantine. So it can affect any persons. And it's good to remind the audience, from the beginning, we knew that the vaccines were not 100% able to prevent you from an infection. I mean, the highest number we have gotten all through these 2 years is 95%. Mm-hmm. And that was with the original mutation of the coronavirus, SARS-CoV-2. And now we are in this subvariant BA2 of Omicron, 2 years later, virus that had mutated like probably 50% of the original one. So it's different. However, these new variants that are circulating now are milder in terms of virulence, but are much higher in terms of the way that they spread and infect. So we can expect that if we don't take the prevention or mitigation measures that we recommend constantly, like wear your masks in crowded places, wash your hands, keep your social distance. All of those things continue to be important, and I don't think they're going to move away from us as we transition from the pandemic into the endemic form. And it's always bad to compare what we can observe, especially if you go to the Bay Area, like San Francisco, for instance, that has a large number of Asian or Asian Americans populations. You see that part of their culture is to wear masks in crowded mm-hmm. places, in public transit and all that, because it's just part of their culture. I think this is becoming part of our culture in the mm-hmm. future for prevention. So prevention, in one word, is what is going to keep us, safe, and that means keeping your vaccination up to date. So vaccination continues advancing slowly as we have less people to vaccinate, and we have a lot of people reluctant to vaccinate in those groups, or kids that are still not eligible. So 82% of the eligible people in the county, those 5 and older, are fully vaccinated. 7% has at least 1 dose. And we're closing now into the 11% of in general, the population are not vaccinated. So that's a great number. We're still number 9 or 10 among the 58 counties here in California. So we're one of the most vaccinated counties, and that's great. Also, another landmark that continues moving in the positive direction is the boosters. 65% 0.3% of eligible people, that's 12 and older, have received their boosters. The second boosters continues moving faster, but only among those 65 and older. The rest of the groups are not getting, a lot of them, their second boosters. It's only a small number that is slowly growing. There are many questions for them, like when to keep your when to do it again. We just spent a few minutes talking about the importance of keeping your vaccination up to date, and we are seeing it. We will see it in the next few weeks. That is very important because you can get infected or you can expose someone to an infection, someone dear to you, maybe. So we have to take care of that. Our new daily cases rate is now 14.8 for every 100,000 inhabitants, and this is measured in 7 days periods, lagging 7 days. So this is from last week, so that gives you an idea that trends keep just growing rapidly. Our overall testing positivity rate is 5.4%. Last week in your show, I was telling you we were around 3.2. So the numbers are increasing, and equity positivity rate is also increasing at 4.9% of the tests that are being held. And now, in a different subject, there's going to be test kits available to summer camps, as is one of the main activities that we do here locally for students during the summer season. So now camps and local education agencies are invited to apply for free at-home tests. This is through a partnership between the California Department of Public Health and the Centers for Disease Control and Prevention, so the CDCs. This opportunity is open to the public, charter and private independent schools, as well as camps that serve, all sort of camps that serve K-12 students. They all can apply for this. I gave you in our previous segment the link. Please post it for people to make it available. It's a long link, so it's better just to read it. But the weekly requests are due at noon on Fridays from now through June 17. And the recommendations are that you can request the numbers of over-the-counter tests that you need. So those are going to be the allergen tests for a period to cover 4 weeks and or for the duration of the summer programming. If you have already received the test, we are recommending that when you go low to 50% of what you received, that's the moment that you have to order again to keep an adequate number ready for the groups that you're going to be serving through your organization. This again for camps during the summer. So that's a way to protect these kids. And then the FDA is also discussing vaccination for younger children to happen throughout June. So it's very likely that the FDA may be approving during the month of June at least one of the 2 vaccines that are in the works for children that are under 5. And this could become available after the three different scheduled meetings with advisors. I have to be more specific here. These are federal advisors. These are recognized doctors and scientists all throughout the nation that get together to approve or disapprove. And the standards are high, the effectiveness and the safety, one of the highest standards among many others. So there are 3 meetings scheduled for June 8th, then the 21st, and then the 22nd. And after that, the FDA could be announcing that they have approved the vaccines, and then the vaccines are going to continue the process of approvals after that from the CDC, and then when it lands in California through the California Department of Health. And also the Western states decide together when to start vaccination. That's been the process all throughout the pandemic. The vaccine maker Moderna requested emergency use authorization for its vaccine, and theirs are for children aged 6 months all the way up to 5 years. And then Pfizer is doing the same, but they are submitting their data for a 3-dose regimen instead of 2 doses. And their plan is for children that are also 6 months all the way to 4 years. The FDA say that it will not delay one vaccine to wait for the other, so they're ready to approve as soon as Pfizer completes the data and sends it in. Moderna already did that, so we can expect to see vaccines available for kids that are 6 months up to 5 years of age, probably at the end of June or at the beginning of July. On the other hand, the local hospitalizations are increasing too, gradually. So this week we have 21 persons that are in the hospitals of the county due to COVID, 2 of them in the ICU beds. And that's something that we haven't seen now for a while. And well, sadly it's coming back, but it was also expected. We were like 2 or 3 weeks free of people in intensive care units due to COVID. The number of deaths is 490. We have had 1 or 2 diseases, departed people during the last 2 or 3 weeks. And then an update on local schools and pediatric vaccine is that the cases in the schools continue increasing. Now we are at 6,207 students who have been reported in the county since August last year, and 666 staff cases. And it's related to the age groups that I'm going to mention. The kids 5 to 11, 47.8% of them have at least 1 dose of the series of vaccines that for them are 2 doses, and only 41.7% are fully vaccinated. And finally, the county is averaging now about 1,603 tests per day. This is what we can collect data in the different testing sites that we have all throughout the county. That doesn't include all the at-home rapid tests that are being used. And now appointments are still recommended, but more testing sites can accommodate also walk-ins. So hopefully more people continue to test as the numbers keep increasing. That's a good way to make sure that that we didn't get infected. And if we got infected, the first thing we have to do is do our quarantine and let know all our close, family or dear ones or people you hang with during the job, or you went with friends and spent some time. It's important to tell them what is the status and to observe the guidelines. All of those guidelines are going to be there present all the time and updated in our website. So please visit socoemergency.org, where you can see all this data that I've been talking about and much more. And that's my report for today.
Definitely, as the weather continues to change, things are starting to get warmer. Although some of us still suffer from seasonal allergies, a lot of people are going to start gathering together on the weekends for barbecues and carne asadas and all of those events. And again, that's where there is a higher potential that one person being infected can get other people sick. And as you mentioned, some of the community members have chosen not to get vaccinated yet. And that may continue to affect us during the summer. But with that, I want to thank you as always, and I look forward to our next conversation, as this information is essential for our community. So thank you for your time.
Thank you. Thank you for having me. See you soon.